Page 435 shows anterior view of the arm. We're going to look at the bicep brachii. Okay, here is the short head and there's the long head. Remember, lateral, long, which will make the other one the short head. Okay. Let's isolate the short head. All right, the origin is the coracoid process, so it does have a scapula attachment on the coracoid process there, and its insertion is on the radial tuberosity. Okay, so down here, the radial, well, the tendon's been removed, but so it's going to be on that spot right there. And its action will help flex the shoulder and elbow and supinate the forearm. Okay, the lateral, the long head, the bicep brachii long head, and there's a bicep aponeurosis, and then the long head, if we isolate it, the origin is on the supraglenoid tubercle, so it goes up and goes in between the greater and lesser tubercle, as you can see there, and that's the intertubercular sulcus, and so the tendon goes up and attaches itself to the superior part of the scapula there, specifically at the supraglenoid tubercle. Okay. This is also a tendon that can pop out. And some people, they just have, loose structure, so it can pop out easy, and it can also pop out from injury. So one of the orthopedic tests to test for that is called Yergason's, and it's just a way to assess to make sure that tendon is still centered in there. Okay. All right. Also, clinically, you're going to this is an area down here that you can strike with a reflex hammer to elicit a reflex. You're assessing for C5, C6 nerve root. We'll talk more about that when we get to the nervous system. Okay. All right, down here, you're also seeing the pronator teres. Okay, now keep in mind, pronation is when the palms go down, supination is when the palms go up. So the pronator teres is going to help with pronation. Okay, so when that contracts, it will allow the palm to go down. All right, another muscle that I want you to know is the Coracobrachialis, which looks like it'll be right there. Okay, notice it runs with the short head of the bicep brachii and attaches to the coracoid process, as does the pectoralis minor. So we have three muscles that attach to the coracoid process of the scapula. Very common with shoulder injury, that coracobrachialis and the short head of the bicep, they adhere together. Okay, and when that happens, it puts a lot of stress on the coracobrachialis muscle, so it ends up doing a workload greater than what it's really designed for, so it gets overworked and gets even tighter. So it starts to create some shoulder problems. Very common, especially with overhand sports like baseball pitching, tennis, football. things like that. So responds very well to adjustments, realigning the shoulder, AC joint, clavicle, the humeral head, so forth. Of course, the scapula, which it sits on top of the ribs, and ribs attached to the thoracic spine. So do your bony realignments, and then the soft tissue work from dry needling to electric stem, and I do a lot of K-taping in this area. So if you can learn to manipulate these three particular structures, pec minor, short head of the bicep, and coracobrachialis, a lot of shoulder function comes back. It's often overlooked, and you can almost guarantee with overhand sports and shoulder injury, this one is going to be hurt.